Good afternoon. Next up, we're going to have the fire department. Good afternoon, Commissioner.
Good afternoon. Thank you.
Good afternoon. You can proceed when you're ready.
Thank you. Honorable Council President and members of City Council, I'm joined this afternoon by Deputy Commissioner Jesse Wilson and our Chief of Staff, Tara Moore. As you know, yesterday the National Institute for Occupational Safety and Health, or NIOSH, released its report on the tragic fire at 1655 Middleton Street that claimed Lieutenant Joyce Craig's life in December of 2014. The Philadelphia Fire Department's official report on that incident was also released yesterday, and both reports are now available on the PFD website. I met with members of the Craig family to review these reports yesterday, and will be offering a series of internal town hall meetings over the next few weeks that will allow all PFD members the opportunity to hear directly from me about how we are addressing the consolidated report's 26 recommendations. Both reports were intensively researched and go into much finer detail. Overall, what they indicate is that PFD has a long road ahead. While the administration's 5-year plan provides the department with a much-needed injection of resources, the department will require additional years of sustained investment to fully complete all the recommendations laid out in these reports. While I wasn't part of the PFD when this tragedy occurred, I am fully committed to working with the resources provided in the administration's proposed budget to make changes that will help move our department forward, while never forgetting Lieutenant Craig and the other PFD members who have made the ultimate sacrifice in service to this great city. If there's one thing I've seen over and over during the past 11 months, it's that the men and women of this incredible fire department always join together as a team to make it work despite any challenge or hardship. I'm confident they will do that again now, with continued dedication and service to each other, our department, and our citizens. With your permission, I can briefly summarize the consolidated recommendations from both reports, since they provide important context for this year's proposed budget and our future plans to continually review, realign, refocus, and reinvest in the Philadelphia Fire Department. There are 26, so I'll read them fairly quickly. Some of them are repeats, but I didn't want to edit them at all. Fire departments should ensure that fire suppression is initiated on the floor level that the fire is on whenever possible. Fire departments should ensure that officers and firefighters are trained in the latest fire behavior research affecting fireground tactics. Fire departments should ensure that crew integrity is maintained. Fire departments should ensure that all firefighters and officers are trained in the use of hose nozzles and hose line management skills. Fire departments should ensure that all firefighters and officers are trained in Mayday techniques and communications. Fire departments should consider upgrading their self-contained breathing apparatus and personal alert safety systems to the latest edition of the National Fire Protection Association standards to benefit from the increased thermal protection characteristics. Fire departments should ensure that personal protective equipment is donned prior to entering a structure. Fire departments should ensure that rapid intervention teams are on scene and activated before interior operations begin. Fire departments should ensure that resources respond in a timely manner. Fire departments should ensure that a stationary command post is established and the command team communicates effectively. The Philadelphia Fire Department should upgrade their current self-contained breathing apparatus, or SCBA. Proper deployment of all personal protective equipment prior to entering an immediately dangerous to life or health atmosphere must be enforced. Continue testing on personal alert safety systems. Evaluation of the Philadelphia Fire Department's current mobile data terminal's ability to assist drivers via global positioning system. Development of a Philadelphia Fire Department operational procedure for basement fires. Development of a Mayday operational procedure and training for all firefighters. Philadelphia Fire Department will evaluate rapid intervention team enhancement. Upgrading the PFD's personnel accountability system. The Philadelphia Fire Department must conduct training for all firefighters on the management and control of all potential ventilation openings in a structure in order to limit fire growth and spread. Continuous training for all firefighters on all fireground disciplines. The PFD must initiate command level training on all the same disciplines and a command school. The City of Philadelphia should consider restoring the engine and ladder companies that were decommissioned in 2009 in order to provide the necessary training required for a large urban fire department and an increased margin of safety for our firefighters and the public. The City of Philadelphia must make an investment into a state-of-the-art training facility, either by upgrading the facility on Pennypack Street or by building a new facility. An operational procedure must be developed for conducting a formal investigation into firefighter fatalities and serious injuries. Establishing officer development for newly promoted lieutenants and captains to be instituted prior to an assignment to any unit. The PFD must retain the position of Battalion Chief's Aide/Communications Specialist. The aide is critical in order to maintain the command, communication, and safety network. The PFD should give strong consideration to increasing staffing levels at the Fire Communications Center. At this point in time, the FCC does not have any staff dedicated to monitor the operating fireground or attack channel talk group. Council President, members of council, I stand ready to answer any questions you might have.
Thank you, Commissioner. I just have a couple of questions. Budget detail, section 44, page 3. Spending in the grants revenue fund is anticipated to come in $7.1 million under the budgeted amount. Can you please detail why grants are anticipated to be underspent? It's usually the other way around. We usually would like to spend more money than we actually have.
Council President, members of council, my guess is that's an anomaly of the appropriation, and that some of that is around federal grants for our Pennsylvania Task Force 1, our urban search and rescue team, and the way the federal government cycles those dollars. So we actually have a number of grants that we are working to continue to provide the detail that FEMA requires, the Federal Emergency Management Agency, to get our reimbursements. So I think it's just a matter of the lag time between us providing all of that and also having an appropriation that is higher than what we might actually receive, because we're always sort of behind the federal grant cycle since they work on a federal fiscal year and we work on our own fiscal year. And since all of these grants are, most of our grants are competitive, and the one grant we're talking about in particular is a cooperative agreement that, because of the way the federal government is doing business with the continuing resolutions, it's very challenging for us to be able to track and budget that and anticipate that with a high degree of fidelity.
Okay, so I can nod my head and act as if I understood everything you just said, or I can ask you to define it a little more precise. Bottom line, the federal grants, you said because of the continuing resolution or the lack of the continuing resolution on the federal side? I
think the short answer is it's more of an accounting issue in the way it's carried on the books and the timing. Rest assured that we will spend every single dollar of grant money that we get from the federal government.
All right.
And we'll try to get more.
That's the layperson's response, of which I am one. All right, thank you. Page 6, actually, what's this? On page 132, the EMS incidents continue to trend higher halfway through FY2017, which is obviously concerning given the drastic increase that was realized in 2016, so we're trending up. Can you talk about the reason for this continuing trend for EMS incidents and what's the department's plan to curtail that?
You know, this is something that I think all fire departments that deliver emergency medical services are seeing across the nation. For us, and it's a little bit interesting, we are the 5th largest fire department in the nation, but we're the 2nd busiest EMS delivery agency in the nation after the New York City Fire Department's EMS division. So we are seeing that continuing to rise, and I think a lot of it has to do certainly with many of the other challenges that we have in this dense urban environment. Some of it is growth too. Density for us generally drives service demand. So as we see increasing density and we're seeing increased development, Center City still actually puts out the majority of our service demand every day. We have a long peak time from roughly 7 a.m. to 7 p.m. A lot of that is coming out of Center City. It's also a 7-day-a-week peak for us because we have so many special events on the weekends and other types of things. So it is going to continue to be a challenge for us to keep up with that service demand. Some of this has to do with the broader issues around healthcare in the United States. Frankly, I don't know that we were ever able to benefit. We had certainly hoped to benefit from the ACA and its I guess, still current form, but it's hard for us to predict what's going to happen. Certainly, we're concerned that some opportunities that we have might be closed off by changes from the to the ACA.
So are you suggesting that from a preventive medicine perspective, which the ACA was supposed to enhance, people can actually go to the doctor before it reaches emergency status? You say that we have not taken full advantage of that here.
Well, I think that safety net was still being built for a lot of folks who didn't have it. And in the absence of another safety net, you know, folks are going to call 911, and we're the fire department. So I think it's important on us, I think it's incumbent on us to, when people need us, to go. Getting to your point about the opportunities, I do think there might be some opportunities for us in the future to maybe be more participative on the front end and do some prevention type things, do some, you know, the term of art for now in our business is mobile integrated healthcare. So could we, for instance, put a paramedic and a nurse practitioner out in a van and see people before they have a crisis? So instead of calling 911, we can either connect them to other services, make sure they get their prescriptions filled. To your point, you know, we have a service demand and a response challenge right now, which is why you see the additional peak time units in this proposed budget. I do think we are going to have to, regardless of what happens with the ACA, we're going to have to find a way to pilot some other sort of prevention-oriented strategies and some other ways to deliver health care as the fire department in a concert with all of our community partners, or we're going to be chasing this forever.
Okay. Let me ask you one last question. Excuse me. The climate in the department, and you and I had a brief conversation about this. There was everybody that in this body knows that the climate, particularly around racial issues, was not the best, and it sometimes showed itself in this public chamber leading up to a public hearing or a particular legislative initiative, which was not very comfortable for us on this side of it, and I'm assuming the prior commissioner was clearly not comfortable for him. Has that changed to a degree, or do you see it changing where we're getting along a lot better within the department?
Well, not being here to witness that or be part of that personally, I certainly have been told and hope that it's changing. And you know, I would knock wood. I mean, these are relationships. This is a relationship business like any other. We've done a lot around structuring. We have a leadership council now that includes Local 22, Club Valiant, SAPFA, CIS, our Officers Association. Some of those groups are here now represented in this chamber. All of those groups in our leadership council, representatives from all of those groups stood with me today when we did the press conference earlier to talk about our way forward after the reports on the tragic loss of Lieutenant Craig. So I think it's going to continue to take work, and it's going to continue to take a lot of work, but we are meeting together frequently, perhaps more frequently than ever before. Folks are at the table working together, finding solutions, and we've made progress on that. We've made progress around having an objective and transparent firefighter transfer policy, firefighter rotation policy. Now we're moving that into officer rotations and transfers. And that really is something that folks are coming up with on their own, working together. So I think we've seen a lot of great progress. We're going to continue to work on it. Those relationships, like our relationships, take hard work. But that's what we need to do. That teamwork really underpins everything else. If we can't do that, we can't do anything else. So it's job number one for me.
Yeah, no, I think it's important to acknowledge that it was an issue. A lot of people didn't want to talk about it, didn't want to see it, but it was an issue. And I'm glad that you're taking it head on, understanding the need to really have a family type of environment. I mean, family in terms of the fire department. We're all family, and we have a duty, and at the end of the day, we're responsible to the citizens of the city of Philadelphia. So I want to thank you for your willingness to acknowledge and take steps towards improving that. Chair recognizes Councilman Greenlee.
Everybody. Commissioner, in written testimony, you talk about the department has an average of 7 to 8 severe structure fires per day, which surprised me. I didn't think it would be that much. Is that a higher number than before, and how does it compare to other cities as far as that kind of number?
You know, continuing to one of the things, obviously in 11 months, we're still, it's been a busy 11 months. We're still kind of doing due diligence on a lot of things. So, you know, that number is probably somewhat accurate, if not especially precise. We, even the definition, so again, I'll break it down in the interest of simplicity and candor. We don't count fires in Philadelphia like other departments.
I know you use the word severe structure fire, so.
And we're still trying to get a definition of that. And again, the bottom line is, over the years, in other places where I've worked or done consulting or been around for the past 25 years, a significant fire in those jurisdictions, here in Philadelphia, we wouldn't even count it because we would say it wasn't a real job. So we're still trying to really understand how many fires do we have, of what magnitude. And so what we think we have at least some working definition of is a severe fire for us would be one that requires, basically for us, what we call a full box alarm going into service. So something on the order of 4 engines, 2 ladder trucks, 2 battalion chiefs, and a paramedic unit to start, and potentially additional resources beyond that.
Go from there. And is that somewhere where other cities are, or is it because we're obviously an older city, older structures in certain parts of the city? So.
Right. I think you're right on. We have a unique built environment. We have a lot of older buildings, so we have some real challenges here around structural fire protection that other cities don't have.
Now, I know the fire department, even before you were the commissioner, has always done a good job in trying to talk about fire safety, giving out smoke detectors, talking about that kind of thing. The fires that we have, has there been any, and I know you've only been here a year, but I don't know, looking at statistics, has the type of fire or the cause of the fires changed over time as far as electrical, smoking, that kind of thing?
The exact split on any given year sometimes changes, but the top causes are generally, electrical, smoking, heating appliances, cooking, and they change orders sometimes. I think last year for us, the top cause was electrical. Okay.
And is there any plans, and again, I know the department's done a lot already in fire safety, but to address some of these issues? Is there, I don't know if there is, but is there any other programs planned or thought about?
Well, and you alluded to it. One of the hallmarks of this department, and it really is a wonderful thing, and it's a great thing about our department, one of the many great things, we're not having to talk with our members about the importance of fire prevention and community risk reduction, and that is a tribute to my predecessors, the fact that that's in the DNA of our fire department. We have a lot of great community partners. The Red Cross does a lot with smoke alarm blitzes. For us, it's a volume, it really is a volume issue. We are going to continually get out and install smoke alarms, provide fire prevention literature. We are looking at some ways to use our existing resources to do that on a 24/7, 365 basis. And as I go out to fires at night, we always try to walk down the neighborhood the next day after we've had a severe fire. Sometimes folks aren't home. So when I go out to these fires, regardless of neighborhood, people are out on their porches when that fire is occurring. So we want to be able to have that interaction when the window is open and deliver smoke alarms, deliver that fire prevention literature, deliver those messages. So we are absolutely looking at leveraging the success we've already had and continuing. That's an important dimension of this. It goes back to the Council President's question about EMS. We need to do that across all of our service lines because we're going to be chasing the response piece forever if we don't.
Okay, thank you. Thank you very much. Thank you, Council President.
Thank you, Councilman. Chair recognizes Councilman Jones.
Thank you, Mr. President.
You're welcome.
And thank you for coming, Commissioner.
Thank you, sir.
You follow a long line of traditional commissioners that come from the 4th District, and we welcome you. That's it. Lloyd Ayres, Harrison, fine tradition of finding a good quality place to live in the 4th. I want to also thank you for your department's commitment to the Randolph Career Technical High School. They have a EMS and fire academy there for high schoolers that is the type of career, school-to-career program, and your officers there spend a lot of time mentoring those young people, and the fruits of that is that they go on to live productive lives, some of them even taking the test to be firemen. So thank you for that commitment, and want to see it continue. I know it's a rough day for you. Anytime we memorialize the loss of life of a comrade or officer, and then have to talk about it in a retrospective kind of view on what happened and what we could do better. I would ask you, Commissioner, what are your takeaways? I heard your 26 points. I understand that. In light of that loss of life, in light of the equipment issues, how do we make sure that that never happens again?
Councilman, I appreciate the question. We, this budget really gets us moving on that track with the dedicated training officers, the new dedicated training officers, additional firefighters to help us raise our relief factor so we can do training in a sustainable way without compromising our frontline service. Of course, starting to address some of the EMS, or continuing to address some of the EMS challenges. There's a lot to do. I mean, those 26 recommendations between the NIOSH report and our fire department's report, that, this is going to be a long-term project. Training is a hallmark of that. So there really is a lot to do. I think for us, the most important thing to start with is to do the best we can with the resources we have and the resources in this budget, the new resources in this budget, to take care of what we have, and that's the people we have. Our primary asset is our people, and then add service delivery units down the road.
So my former colleague, now Mayor Kenny, was and is a proponent of this department. He talked about the brownouts. Did we take that off the table now? We don't have those.
On Mayor Kenny, I think it might have even been before day one, but I wasn't here. The brownouts stopped. The forced rotation of firefighters was stopped, and now we're using a different, again, collaboratively developed way to provide for some movement in the system across the different deployments and different firehouses. So those have stopped. Now really where we are, and you'll see that in this budget proposal, really focusing on training, having the capacity to do training, the resources to do training, and also safety. We've put in some dedicated safety officer positions. We've put in some dedicated positions in our communications center. And that actually happened, thank you, I guess, retrospect, that's actually happened at mid-year. So we are well on our way, but it's a long-term project.
So specifically, the response time it took for the officer who repeatedly requested help, and the time it took for the backup units, is that a part of adding staff? Is that a function of knowing quicker routes? What specifically are we doing to address that issue?
It's a great question, and I think the answer is all of the above. Firefighting, while it may look simple, it's very complicated, happens in a complex operating environment, and I use that term deliberately because you don't always know all of the variables and you can't specify those. So what you saw in these reports in this incident is not uncommon when you look at reports like this from across the country. There were a series of contributing factors. Any one of those in isolation, we would not have had the tragic outcome. All of those factors together combined, and it does ultimately go back through everything you mentioned. Where are our resources? How long is it going to take them to get to certain points? With what training? How long does it take to assemble an effective firefighting force? How do we properly command and utilize that force and manage that incident, which is a very difficult thing to do in any place at 2 o'clock in the morning on a rainy, cold night.
So finally, I've been up to the Fire Academy a number of times. The grand fourth floor up there is hard to get to. If you had your druthers, if you had President Clark's magic budget checkbook, what kind of facility would you like to see up there?
Council President, you didn't show me that magic checkbook when we talked that day, but
it's for members only.
Apparently certain members. Councilman, it's a great question. I think realistically, and what you'll see in the plan, in this budget, in this 5-year capital plan, 6-year capital plan, there is money in there to start the design and start site work on essentially rebuilding on that site to do a lot of what we need to do, what I'll call the hard skills training. So having our burn tower, there aren't many places in the city where we can actually make the kind of noise and do the kind of things that we need to do to create a realistic training environment. So I think despite how far it is, the Pennypack Street location is probably good for that. We had a needs assessment that Public Property did in concert with the fire department, You see that in the 6-year capital plan. I think that's our best option for that component. We are also looking at other options for really creating a training system, so it's not just at that location. We can do it anywhere, anytime, 24/7.
To your knowledge, is there a better training facility somewhere that we could model it after, or are you going to design build from scratch?
We actually, frankly, the folks that did the needs assessment did a really nice job and did look at some adjacent training facilities here, so we didn't have to go far to find some good examples, and I think we'll certainly want to learn lessons from all those folks.
Thank you, Mr. President.
Thank you, Councilman. Chair recognizes Councilman Dom.
Thank you, Council President. Good afternoon. A couple of questions I wanted to ask. In your testimony, under salaries, I just want to make sure I'm clear. Does this show where the fringe benefits would be and what percentage they are of wages?
The fringe benefits, to my knowledge, are carried elsewhere in the...
Carried elsewhere.
This does not include fringe benefit costs.
Do you know what those are as a percentage of every dollar paid?
49% is what...
49%, okay.
For a uniformed, and that's for a uniformed employee.
So it's roughly 49%. So essentially, when we pay overtime, if we hired somebody new, it's almost a wash.
There is sort of a tipping point there. There's kind of a sweet spot on overtime versus,
Right.
new
But
hiring.
every new dollar of expense is going to create a 50 cents more in benefits. And overtime's roughly 50% extra, right? 1.5%.
There are a lot of, basically that's true. There are a lot of other factors that go into it in terms of leave usage, the demographics of the department, and,
Okay.
but yeah, there is always a sweet spot. In fact, there are some departments, albeit at a much smaller scale than we are, where it is cheaper to pay the overtime than hire additional staff. We're not at that scale, so we think we do need additional full-time positions to be able to accommodate the relief factor and cover the majority of our leave usage and other unanticipated vacancies, because we do have to fill the seats. But I think to your point, there will always be overtime at some level. If we were to staff above that, if we were to get rid of the overtime, we'd be paying more than we would be running a less than efficient system.
So then that goes to my next question. In fiscal year 17, the overtime appropriations were $19,824,000. In the first and second quarter expenditures this year, I guess, fiscal year, it's $13,008,000. So it seems like it's really mushrooming up.
There are a couple things in there. The DNC, of course, is still in there. We are affected, as is the police department, as you heard earlier, by when the police are there and the police have to heavy up for these protest events and other things, we are there as well. We actually just instituted last month an overtime tracking system in concert with payroll and finance, and we're kind of working the bugs out of that to make sure we get good data. That'll give us a better sense of where we're spending the overtime. My sense is, historically, and even right now, the majority of our overtime is going to filling minimum staffing positions, but there have been those couple major special events. And the draft, of course, coming up will probably keep that running ahead of schedule.
But if we stay on that track, we're going to be $7 million above what we were the prior year.
And that is without doing any additional training, yes.
The other question I have is, in the budget, there's a payment of like close to $8 million, $7,972,000 to the water fund. How's that payment determined? And is it based on usage, or how is it determined?
Councilman, I'm 11 months in, still trying to understand the answer to that question.
It's a good question then, I guess. Well, you can get back to me on that one. So here's one of my overall concerns. The police were up earlier, and when I'm looking at the math, the police's increase in their budget is about 0.3%, and the fire department's about 12%. What I'm looking at is fiscal year 17 original appropriations to fiscal year 18 proposed appropriations. So 12% is a big increase in the budget. I'm not saying it's not needed, but I guess on the other side of the coin, what other methods do we have in the fire department to look at other areas where we can cut overhead so the increase isn't as large?
Councilman, again, I could refer back to the 26 recommendations that I read from that federal agency and that investigative report, and I could recapitulate those. These are the things that we need to do to start addressing those recommendations and make sure that we have a safe, effective fire department.
Do those recommendations are incorporated into fiscal year 18?
Fiscal year 18 gets us started on addressing those recommendations, yes, sir. And also the EMS side of the business, as we talked about, which is continuing to, that demand is continuing to increase too.
So if we're looking out to fiscal year 19, how much, do you have any idea, is the increment going to be as much as this past year of 12%, or is it going to be less?
Well, I think that's probably at the outer limits of my ability to forecast. Part of it is and again, part of it is our ability to actually execute against the things that we need to do. So it's, as you know, it's one thing to have the dollars, it's another thing to be able to execute and bring projects to completion and develop new programs and do the training. So we're trying to ramp that up. That's a lot of what we did in mid-year with our realignment by adding additional staff positions and staff capacity so we can move those projects and programs to completion. As we continue to do that, which is still kind of underway, that will influence how much we're able to do in the out years.
By the way, let me clarify my statement. My statement on the difference between the police department and the fire department is that that's strictly under the category of Class 100 employee compensation. Under employee compensation, the police department's projection is 0.3%, and the fire department's 12%. Employee compensation, not equipment or anything, but just employee compensation.
Right, I think that, and that those are new positions and overtime to do the work. And I think, again, I'll echo what the police commissioner said. This is about boots on the ground. It takes people to do the training. It takes people to take the training. So at the end of the day, whatever happens going forward, it will be about, first and foremost, people to get the work done.
Okay, thank you. Thank you very much.
Thank you.
Thank you, Council President.
Thank you, Councilman. Chair recognizes Councilwoman Kiona Sanchez.
Thank you, Council President. I want to thank you. I know coming from the outside, it's quite difficult to learn how Philadelphia operates, but as someone who was a little concerned about how that transition was happening, I really appreciate your professionalism, your candor, and more importantly, your commitment to the folks that serve in the department. And let me give some unsolicited advice as it relates to this report, and not to drag this out. I think for years, for the reasons that President Clark mentioned in the beginning, there was a lot of internal tension and this need to keep everything within the department. And this report might be an opportunity for you to bring some additional fresh eyes and advocates to take the fire department where you want to take it and where you see it going, so that, to Councilman Dom's question about what you're going to need, I think this report, what happened is going to cause some points of reflection, and I think you're going to need more. And so, you know, it's worked for our criminal justice reform. We did it on the L&I committee, and having a separate set of eyes of different stakeholders at the table may help you navigate some of that and create the kind of public support for what you're trying to do internally. So sometimes it's hard to manage external eyes. I think we're in an age of transparency. I strongly encourage you to utilize the expertise that are in the city, from policy universities and others, about what are we going to, lessons learned from a very tragic situation. And with that, I want to ask a little bit around, I know that you, in your testimony and in your report, you acknowledged that there wasn't really a language data kind of collection strategy as of now. We do have a law that requires a language access plan, and let me strongly encourage you to try to figure out some of the ways that in the interim we can come up with some of those data sets. And we've had a lot of resistance from departments, particularly uniform departments, in capturing data around the need. So it's always hard to justify, because, you know, I'm always asked as an advocate to, you know, the need is not there, but there's also no internal encouraging of, let's document when there is a need, because that helps us justify the need for personnel and and training and so forth. So just because you are new, this is a level of resistance internally for folks to do that. So be aware of that. Do you have any thoughts coming from other cities, what you've seen around language access
Well, I think
and
it's
diversity?
I think it's critically important. I mean, we have, last time I looked, 141 different languages and dialects spoken in this city. Those are all of our citizens. Those are all of our customers. We are participating fully in the language access planning efforts. I know our firefighters and paramedics are using our language hotline every day. And of course, we do have a lot of bilingual or multilingual members. We just don't have a good data set to accurately capture that. We recently started a new cadet academy, a new group of firefighter cadets. I think, 10% of those folks are bilingual, and we're going to continue to reinforce that. I think, I think it's vitally important for so many reasons. And you also mentioned the importance of diversity and inclusion, and it is something that we have to continue to work on. We will always need to work on it. We did an unprecedented recruiting effort this year, put more resources into that than we ever have before, and I'm hopeful that those will continue to bear fruit. We're working very closely with Director Rodriguez and OHR to talk about some other ways that we can help make it easier for folks to, when they become interested, to move into the fire department. We're talking with Parks and Rec about some camps over the summer. So we really are trying to move forward on all fronts. And then we will be, of course, we have a lot of training needs and requirements, but providing the opportunity for folks to learn new languages, or if nothing else, at the survival level and the multiculturalism, that's going to be high on our list. And I think that does go straight to the teamwork piece as the demographics of our department change.
Yeah, I mean, clearly bringing people to the table, both from a union perspective, Valiant, SAFA, and other folks, is huge, and it's a big step for folks. It really, I think, is going to help people believe that there's an opportunity for folks to work together and that there's a win-win in all of this for everyone. So we strongly want to encourage that. The Fire Explorers has been very successful. I love this program. And I think you're ahead of some of the other departments as it relates to that. And I do think that that this is a unique opportunity, because we are going to be staffing up from an EMS perspective, and others is, how do we create that pipeline? You talked about Randolph Center. We have an interest. We support it. We want Philadelphians to get these jobs. We want our students. I've never met a kid who didn't get all glazy-eyed when he saw a fire truck. I mean, that just comes with the territory. So I just think it's ripe for opportunity, and with tragedy and chaos, as someone new, comes a lot of opportunity. And so I encourage you to utilize all of that and not feel like you got to maintain the culture of the past, which is like, we're going to keep our mess in our house. As opposed, I hope you feel like this is our house, and everybody needs to be part of that solution.
Absolutely. Thank you.
Thank you, Mr. President.
Thank you, Councilwoman. Chair recognizes Councilman Green.
Thank you, Council President. Thank you, Commissioner, for the work that you and the members of your very dedicated workforce do every day in protecting people in a lot of different tragic situations throughout the year. So I want to thank you for the work and the work of the other members of the fire department. A couple questions. You were talking regarding your 26 points, and you gave some information to Councilman Jones regarding a new training facility. You also mentioned in reference to engines and ladders that were closed in 2009. Do you have any idea, you talked about that point, do you have an idea of the cost perspective in that regard on a macro level?
Well, it's an important question. I think, for us, again, when we talk about restoring or adding a company, remember, it's the number of folks to cover minimum staffing times 4 platoons, plus a relief factor. So, you really cannot restore a company for less than $1 million, and that's without the hardware. So that's just the people cost, that's just the personnel cost. How to do that, and again, I think because of that, the magnitude of that investment and the policy implications of doing that, how we do that has to be a very thoughtful and data-informed way. Right now, as I talked about before, we don't necessarily have the data that we would want to be able to do that the right way, or even plan for that or project that. So we have part of our realignment, we created a planning and risk reduction section, and we're bringing in, to the Councilwoman Quinones Sanchez's point, we're looking at bringing in some folks from colleges and universities to help us make those decisions in a data-informed way. We're already doing some partnerships with some other colleges and universities, and we're building the capacity in-house to be able to answer those questions. We need to have all that to be able to do this right versus just, adding. And first and foremost, we really do need to address the recommendations that affect our current workforce today first, to make sure that the 1,000 times a day that we're going out the door, we're doing that in the safest, most effective way. So I think that's kind of the way our priorities have racked out. And we'll have better information on those kind of system decisions in the future.
Okay. All right, thank you. Also, I know from my experience in the past, some of the issues that firefighters have had over the years, either from hepatitis C or ear injuries or other type of ailments they may occur on the job. Has there been additional, I guess, new technologies or training or new equipment that can address some of those issues?
That, and I appreciate you saying it, that is another really important part of the recommendations and also our addressing the recommendations. Just 2 weeks ago, we actually put a new full-time dedicated field incident safety officer at the deputy chief level on every platoon. So now we have 24/7, 365, somebody who's dedicated to the safety and health of our members. Those folks will be doing training and really kind of digging into all those things that you're talking about, whether it's bloodborne pathogens, hearing protection, wearing all the personal protective equipment. That was a repeated recommendation that you heard in these reports. So we are already working hard to enhance that along with the training component.
Okay. One of the questions I asked to the members of the Police Department and Commissioner Ross was in reference to issues concerning people in our city that have learning differences like autism. And I'm curious from the perspective of the fire department, do you have any type of training or other type of initiatives regarding how first responders, how they encounter people that have learning differences like autism?
Not to my knowledge, we've not had that kind of training. I have been, at least not formally or officially in the department. I have been, as I've gone around the city, certainly talked to a lot of different groups about different ways that folks learn and interact with the community. So we are very cognizant of that and certainly want to make sure that as we develop our training capability and our capacity, that we include things like that and bilingualism and other types of trainings.
Yeah, one of the initiatives started by former Councilman Dennis O'Brien was the Philadelphia Autism Project, which is something I've still been involved in. And I think we do an annual conference in May, but going forward, I think that's something that both from people in the autism community would have interest in reference to how firefighters deal with situations, especially when they first come on a scene of an incident, how they interact with people. And I think it would be a good educational perspective, both from people in the fire department as well as those in the autism community or the learning difference community. Another thing, and I've kind of brought this up with you in the past in reference to the Fire Ops 101 scenario, which I think is a really good opportunity to really learn what it takes to be a firefighter. Having gone through that experience I guess some years ago, at that time I think Mayor Kenny went through that, Mayor Nutter, a number of elected officials and there's others. I think it really gives people a better understanding of what it's like to be a firefighter, at least a little glimpse in reference to just the level of science and just the strength requirements and just endurance requirements to be a firefighter in the city of Philadelphia. I know there's the financial cost to doing that, and I know that was part of, I'm assuming part of the reason why it cannot be continued, but if there's some way you could either capture that concept to allow, either like officials, other officials in the city, just to kind of maybe do a day in the life of a firefighter, I think would be a good opportunity, even if it's just going, visiting during one of the training, when you have a training class for someone to just kind of walk with or be with people who are going through training, because I think it really gives people a much better understanding of what some of the members of your department go through on a daily basis. That I think will be much very helpful as we go through the budget process when people have that understanding. So thank you.
Absolutely. We look forward to providing council that opportunity. We also started this year a Citizens Academy where we're bringing folks in or opening it up, not to actually go into the fire, but to see us put out a fire and do things like that. So we're looking forward to doing that again as well.
Thank you, Council President.
Thank you, Councilman. Chair recognizes Councilman O.
Thank you very much, Council President. Good afternoon. I don't have much. Let me just say that I have really enjoyed interacting with you as Fire Commissioner and with your senior team, and I particularly appreciate how you are at so many different events throughout the city of Philadelphia, and particularly I will say that regarding the mayor's task force to combat heroin and opioid and all that the fire department does there. So thank you for that. I just wanted to ask your kind of opinion. I did the same thing with the police commissioner, just in terms of state-of-the-art technology, when it comes to the firefighters themselves, whether or not there's an opportunity for, does it make sense for some additional equipment such as body cameras, even cell phones that have GPS devices on them to understand where all the personnel are? Does it make sense to have drone capabilities with thermal imaging just to identify, you know, where the people are, if people are there, where the heat's coming from, to go ahead to just make sure there aren't false alarms? So I know I said a lot there, but could you go through just some of the things in your mind about what we could do to better protect our citizens and our firefighters through technology?
You know, for the core business, and I appreciate that. First of all, I love the city, so I love getting around and doing events, and I'm really enjoying my time here despite the challenges, or actually, I guess, because of the challenges. You know, I love what we're doing here, and I appreciate those comments. Certainly, I think there are a lot of ways that we could use technology in the future. The core of our business is, again, as you saw in these reports, it really is about, there haven't been a lot of changes to the way we have to get that work done. So I think there's probably limited utility for technology in that environment, and I'll use the cameras as a great example. It really is, it's a zero visibility environment, and again, you know that from some other things that you've done in your career. We just purchased some new thermal imaging cameras to replace our older technology, so that's been a real upside. Our hazmat unit uses technology. They have a couple of robots that they use. I think really for our core business, it's about taking advantage of the best technology, whatever is the lightest, most streamlined in terms of the personal kit, the personal protective gear, structural firefighter protective clothing, which down the road, I think there are some opportunities there. And of course, making sure that we stay up to date with the most current self-contained breathing apparatus and personal alert safety system technology. We're where we need to be. In fact, those are the two recommendations that we can check off that list. We want to make sure that we stay up to date, because that is the most critical item of personal protective equipment that all of our firefighters have. And we're also using technology better in EMS, or more in EMS. Still, it's first and foremost about the people doing the work. We will continue to look at those kinds of opportunities, though. We're engaged with some Department of Homeland Security Science and Technology Directorate efforts to maybe pilot some new technologies, because there is no better or busier testing ground than here in the city of Philadelphia.
All right, thank you very much. That's all I have, Council President.
Thank you, Councilman. Chair recognizes Councilman Johnson.
Thank you, Council President. Thank you, Commissioner, for being here today with your team, and just want to commend you for the work that you have done since you arrived to the city of Philadelphia. I want to also thank you for, I think most recently, you did some type of tribute to Lloyd Harrison. I think that was a big deal, symbolically. It was touched on when I first came in this room about, to be quite frank, some of the racial tensions and histories of the Philadelphia Fire Department. And when I saw that, the tribute, I was like, wow, it says a lot in terms of the culture. So I do want to thank you for your leadership in taking the fire department to the next level. I have just a trivial, I don't want to really call it a trivial question, but I'm soon in the future, I'm going to be hosting hearings regarding alleyways here in the city of Philadelphia, particularly if you live in Point Breeze, Grace Ferry, South Philadelphia, Lower South Philadelphia. We have alleyways where are filled with trees, trash, debris, and so I just wanted to get from you your expert opinion on one, what do you recommend for individuals who are faced with an emergency, and they can't get out the back, so what would be their second means of egress? Because I think it's an issue that's, one, we could be addressing more aggressively, and there's like a rule that says you own half of the alleyway up into the middle, right? I don't agree with that, but that's the city's policy. But nevertheless, my constituents say, I want to hear that. Can't get out my alleyway. If something happens, then, you know, and it's kind of weird, because I remember when I was a kid, my mom had cut her foot, right, real bad. And we had to leave throughout the alleyway because we lost the keys. And back that time, you had keys that will allow you to get out the house. So we had to literally go out the alleyway to get to, you know, heading around the front, right? So she can go to the hospital. What's your recommendations? How do we address this? Or do we wait for a catastrophe to happen and then it's like we weren't proactive?
Well, you know, Councilman, I appreciate the point, and certainly was honored to be able to
Excuse me one second. Did I
recognize.
take up all my time just by asking the question?
Councilman,
It was a great question, Councilman, for what it's worth.
Councilman, actually, I think it was,
I said,
you know what, I'm not going to answer that.
Go ahead,
Just go
Commissioner.
ahead, y'all.
I appreciate the comments about Commissioner Harrison. He really was an icon and somebody I grew up reading about, and I'm glad we could honor him. You know, look, I think I appreciate you giving me the opportunity to spread the fire safety message. We really do need folks to have 2 ways in and 2 ways out of bedrooms, homes, you know, closed doors when you sleep at night. As far as the alleys, it is remarkable. As you know, we talked about the unique built environment. The best way for our firefighters to deploy and our medics to get access to patients is by having as many different access points around a building or a structure or anything as possible. Anything that obstructs that can be a problem for us. And again, it was not a factor in this particular instance that we talked about earlier, but you can envision a case where if we can't get a fire engine to where it's supposed to be able to go, that could materially affect the firefight, the strategy and tactics that we use, and it puts all of our members in danger. So we really do need folks to kind of be thinking about safety holistically, not just in their homes. Of course, smoke alarms, call 311 if you need a smoke alarm and can't afford it, we'll get it out to you. But look into those exit drills and do it. It sounds corny, we all did it in school when we were kids, but making sure that everybody knows what to do in the case of an emergency and practicing that so you know if you got to get out the alley, that there's a way to do that, and if not, how do you rectify that on the front end? Otherwise, it could end up in a tragedy. So I do appreciate the question, and this really is, we're fond of saying in the fire department, fire is everyone's fight, and that's the kind of thing where everybody can contribute and help us help them.
Thank you.
Thank you, Councilman. Chair recognizes Councilman Down.
Thank you, Council President. Maybe could we ask, maybe it's Anna Adams to come forward to taking out of the bullpen here.
Probably couldn't.
I mean, I'm still having a hard time understanding this budget, because the biggest piece of this budget is the Class 100 employee compensation. And when I look at the charts in our big book, it actually says that the number of incidents from 15 to 16 were up 1.75. The actual number of fire incidents were down a little from 15 to 16. 16 was less. And actually, the fire incidents from fiscal year 10 to fiscal year 16 have been between, fiscal year 10 was 47,000, fiscal year 16 was 48,009. So they're pretty similar in the number of fire incidents. The emergency medical has gone up, but not dramatically. And my question is, if we're hiring 70 to 80 new people, why is there an increase in Class 100 from the original appropriation to the proposed of 24 million?
So Anna Adams, Budget Director. So I think the Commissioner pointed out that those salaries of those 72 people are obviously now included in the FY18 budget. So obviously that means that
What do you allocate for what is the average salary and what's the average benefit? And the benefits aren't in here, by the way,
This
just
is not the
salaries.
benefits, this is just their salaries. So I can get you exactly what the cost of
But
each.
on here it says salaries full-time 70,486.
Yeah, but the starting salary for the newer employees are going to be less than that.
Just
'cause
use
they're gonna come
70,000
in.
times 70 people is 5 million. This is 24.
Yeah, so we have, and then there are, I mean, if you look in their budget detail, you'll see by line each item in here. So you can see we've added additional resources there were L&I positions related to it's from the L&I report that comes in too. That's over and above the 72 positions that we talked about before. There is the fire code unit training, that's also class 100. So the lists it all here, so you can see this 11.1 million in the fire. On page 4 of the budget detail, it has a list of exactly what's going on by class in the general fund. So not in the 5-year plan, but in their budget detail, in their big binder.
Okay.
If you look at page 4, you'll see it listed by each item, and then you can see it totals 11.1 in the general fund, and that's the amount that we're adding over the 17 budget, and you can see it all broken out by each one. And so you can see EMS, you can see firefighters, you can see the additional firefighter class, you can see the SAFER grant. So one of the things that happens, as the Commission just pointed out, seeing the SAFER grant, is that we have an obligation after a certain period of time so that the general fund has to pick up the cost of federal funds, and that shows up in this grant, in the general fund too. So it's all laid out on page 4, but I can talk to you in more detail after you've looked through that.
But why does it seem like in the fire department, our appropriations are never really close to the obligations?
And actually, that's something that we've been really trying to address. So one of the things that happened, if you remember last year, is that in FY16, we had all these firefighters that started right at the end of June. And I think when the original budget was put together in FY16, I don't think anybody truly anticipated that it would take the timing of that class. And so that led to kind of the increase in FY16, as well as the policy decision about brownouts and the other decisions that were made when the Kenny administration started. We've spent a lot of time with the fire department this year, trying to make sure that we are getting to the point where we understand overtime a little bit more, so we can understand what's going on, so that we can budget more appropriately for overtime, but also to make sure that they have the staffing levels and getting closer to the point that the Commissioner talked about to get towards a relief factor that we need. It's going to take us some time. We're still getting our hands around it, honestly, to make sure that we are budgeting appropriately. You'll see that from the FY17 adopted budget to the current estimate has gone up pretty significantly. Some of that is through, we did a transfer ordinance in the fall, we're going to be doing a transfer ordinance in the spring. We're working with Councilwoman Sanchez's office right now on that ordinance to try and get to the point where we think it's going to get into a closer estimate for FY17 for the fire department to get towards that staffing level we talked about, but it's still a bit of a work in progress. The Commissioner also mentioned things like the protests that come up and the DNC that come up. We're still getting our hands around how we budget for special events, honestly, and we aren't there yet. We're getting closer, but we're not there yet.
But wouldn't it be smart of us to have a category called special events?
We've actually talked a little bit about that, and each special event, unfortunately, is a little bit different, and some special events get fully reimbursed, some don't. But we have spent a lot of time with each department on special events. It's hard to do because each event is going to cause different challenges for the police department, the fire department, parks and recreation, public property. They all have sort of a different role. So we're trying to get a better sense with special events. We spent a lot of time. We're not there yet, though, unfortunately.
Okay. All right, thank you. Thank you very much. Thank you.
Thank you, Mr. President. Very quickly, about 3 years ago, I'm a guess, we passed a bill requiring smoke detectors to have lithium batteries. Those batteries being 10 years as opposed to every fall or change of season changing your batteries. I'm scared to ask, but I'm going to ask anyway. Are smoke detectors making a difference in reducing deaths in those years?
I think smoke alarms are absolutely making a difference in reducing deaths. I went to a fire earlier this year up off Roosevelt Boulevard where literally the companies passed a family that was on the way out when they were headed in, which is what we want. And it was because of the smoke alarm that that family was getting out. It was an early morning fire. When we went in and took the smoke alarm off the ceiling, it was one of those 10-year lithium-ion smoke alarms that our firefighters had installed. So that is, in concert with the Red Cross and Citizens for Fire Prevention and all of our other partners, that is something we have to continue to do, and we need to ramp that up. At the same time we're increasing our operations capability, we have to double down on those community risk reduction and fire prevention efforts, as well as move that over into EMS with fall protection and things like that, because that will also help keep our EMS service demand from running away unchecked. But yes, that made a difference, not just here, but it's made a difference in other places, and it's been huge for us.
We do a lot of things. We get to go to a lot of parades and stuff like that, but I can tell you to a person in here, nothing for us is more important than keeping the citizens safe. And when you said that, made me feel good that we insisted upon that, Mr. President, and we got it done, and it is making a difference. So I was afraid that it was one of those questions. I was afraid to get the wrong answer, but that's good to hear. Thank you, Commissioner.
Thank you.
Thank you, Mr. President.
Thank you, Councilman. It appears that you all are done. So I would recommend that you leave before somebody else comes downstairs. Thank you so much for your testimony.
Thank you, Mr. President. Thank you all.
Thank you all for your great work. Appreciate it.